Thanks, Devin. Well, February is Heart Health Awareness Month, and here to tell us more about the symptoms and treatments for COVID-related myocarditis is Nurse Christina Paris from the VA. Good morning.
Hi, good morning.
So what is myocarditis?
Okay, wait, before we talk about that, since we are having a heart conversation, a heart to heart, I brought us some conversation hearts.
I'm so excited. You're so cute.
This is a great way to start nursing.
Is it? It's February.
They're so yummy, too.
So when we're talking about the heart, we have deoxygenated blood, and that's blood that, has gone through our body. It goes through the right side of the heart and then into the lungs and then up to the left side of the heart and out to the body. So what happens with COVID is, as we know, it affects the lungs. So when it affects the lungs, that it kind of causes some pressure and damage to the right side of the heart and inflammation, which is where we get the itis part of the myo, as you said, we talked earlier, is the heart. So that's basically in a nutshell what it is.
Okay, so is this so I've heard like it's a side effect from the COVID vaccines, or is this strictly from the COVID virus itself?
So that, of course, is undetermined. That definitely can be either. Yeah, they haven't done enough studies to prove that it's from the vaccine, and I don't want to dissuade people from getting the vaccine, especially if you have high blood pressure or known heart disease or diabetes or heart failure or any kind of lung issue. It really is important. Yeah, so I just think it does help save lives, when you weigh the benefits. But that's a great question, and we do get that a lot. Yeah.
So then what are the symptoms for myocarditis?
So when you're talking about myocarditis, when you get COVID, you're going to feel kind of yucky. Right now, this Omicron feels like a sinus infection. So people will say, I don't have COVID, I have a sinus infection. I'm like, ooh, let's rule out COVID first. But if you start to experience any kind of chest pain, if you start to feel dizzy, fatigued, if your body aches, or you notice any kind of irregular heartbeat, you feel like you're nervous when you have no reason to be nervous, your heart is just kind of racing, but you're sitting normal, that's when you want to kind of go and get checked out. Any shortness of breath, swelling in your extremities that's not normal for you. People with congestive heart failure will have swelling, but if it's kind of unusual or more, you definitely want to go in and see your provider.
And how is it treated?
So with treatment, they'll do some x-rays, and usually we can kind of see those things on a chest x-ray, some blood tests, things like that. But they can give you medications to help with your heart, blood pressure medications that we typically give, maybe a diuretic to help remove some of the swelling. And your doctor may want you to do some lifestyle changes, like involving low sodium diets and fluid restrictions.
So would you have to go to the hospital? Is this more like hospital treatment? Or
so that's a really good question too. Definitely call your doctor to discuss. Now, any shortness of breath that comes on suddenly after COVID or any chest pain, you should always go right to an emergency department and get evaluated, because there is a type of pneumonia that can occur. So,
interesting.
Yeah.
All right. Well, I appreciate you coming in, Nurse Christina.
Yeah, thank you.
See you again next week, and thank you for the candy.
Hey, enjoy.
Thank you so much.